The following segment is sponsored by Dr. Lampee.
Welcome back to Afternoon Live. A great smile doesn't just communicate happiness, it also is an indicator of your overall health. Here to share more about the importance of your oral health and how he can help, we welcome back Dr. Heath Lampee is with us today. How are you doing, doctor?
I'm doing good. Thanks for having me, Kara.
Well, of course. Welcome back to the show. You know, talking about
Thanks.
this, and we mentioned this, that the great smile isn't just a pretty thing to have.
Correct. It is wonderful to be able to show off those pearly whites, but underneath that, we need a healthy mouth for a lot of reasons. Bacteria in the mouth, abscesses, cavities, periodontal disease, have been shown to actually be able to get into your bloodstream, which can overtax your immune system. It can increase your risk for heart attack, stroke, but what we're also finding with coronavirus is the patients that are healthiest survive coronavirus and have the least amount of ill effects. So if your mouth is healthy, the rest of your body can be very healthy, so your immune system can be very strong to deal with bacteria, viruses, stuff like that.
I'm sure there are many, but what are some common symptoms or warning signs that they need to come see you?
So many of my patients, they do wait years to come in, and the warning signs that we see, there could be little bubbles in the gums, that's like an abscess, could be swelling, could be broken teeth, could be hot or cold sensitivity, could also be teeth that are rotating, shifting, getting gaps, your gums bleed easily. These are the signs that there is a lot of infection going on in your mouth. And over 50% of the population actually has some form of periodontal or gum disease as well. So it's very, very frequent.
Yeah, very common. You know, people wait so long. Is there a risk to continue the wait if you know you're seeing these signs?
Well, the risk is you have these bacteria that can get into your bloodstream and affect your immune system, and different risk factors for autoimmune disorders, heart attacks, stroke, stuff like that, and also diabetes. So it is important to get this under check if you want the rest of your body to be healthy. For decades now, people really haven't understood how mouth health correlates with whole body health. And we're really just in the dental community starting to educate other dentists about this to get the word out, because they weren't educated in that when they went to dental school.
So talk about these treatments that you do and how they actually help then conquer the mouth and your overall health.
Okay, so we do 3 different treatments. For patients who have very, very infected teeth due to gum disease or severe cavities, we actually have to remove the teeth, and we actually in one day can do a permanent implant solution that replaces all of the missing teeth with implants permanently in one day. It's incredible, and that helps get all the infection out of the mouth. We get all the abscesses, all the gum disease, all of that. Our second option is crowns and veneers, and that's where people who, you know, maybe their teeth are broken down a little bit, they have old fillings, cavities, stained teeth, rotated teeth. We can basically put a whole new layer of enamel on them in a day and get all the infection out, and they also get that beautiful smile too. Our third option is very, very interesting. It is called the Lampee laser, and kind of like LASIK is a laser for the eyes, Lampee is a laser for the gums or the mouth. And the Lampee laser is all about getting rid of gum disease, which is a lot of nasty bacteria that grow underneath the gums. So the laser gets in there, zaps and kills all those bacteria so that you can have a very healthy mouth and those bacteria don't get into the bloodstream and affect the immune system. And that's the way to reverse gum disease. It's amazing.
Let's take a look at one of your patients, Mary. Talk about the issues that she was having and what you did.
So Mary hadn't been to the dentist in a lot of years, like most of my patients, and she didn't know where to turn because she knew that there was a lot going on in there, but needed someone that she could trust to help guide her through the journey. And so with our consultation, we were able to find that Mary's upper teeth, we were able to save with our crowns and veneers, a full Lampee rejuvenation with the top with the crowns and veneers. The lower, the teeth were doing pretty bad on the bottom. So on the lower, we were able to do our full implant solution down there. And we were able to do all this really in just a couple days for most of the work. There were follow-up appointments to finish everything, but the vast majority of the work just done in a couple days and done comfortably with sedation so that, you know, patients can have a positive experience.
And I know she's probably come back to see you to check in. How has her life changed in just her smile?
Well, I just love it when she comes here because she gives me a big hug. It just tells me that we did a great job. She's got that zest, that energy, that spring in her step that I see in so many of my patients when I see them 3 to 6 months after their procedures, their rejuvenation, that they are completely different people. And for a lot of my patients with autoimmune disorders and diabetes and high blood pressure, I find that 3 to 6 months after their treatment, those conditions actually improve. It's incredible.
Oh, that is incredible. Neat things that you are doing, Dr. Lampee. Great to talk to you as always.
I appreciate it. Thanks so much.
And I want to let you know that you can call Dr. Lampee 503-646-2273 to make an appointment. And also go to our website for a link to his website at katcu.com. Do not go away. More of Afternoon Live right around the corner.